For cybercriminals, the havoc wrought by COVID-19 is blood in the water. And yes, it has brought the sharks circling around. Bad actors, whether domestic or nation states, such as Russia, China, and Iran, are trying hard to exploit vulnerabilities in America's infrastructure and its reliance on cyber networks. This has especially serious implications for hospitals and our heroic caregivers. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, senior writer with AHA. On the plus side, America has a vast defense in place against cyber attackers. Many agencies, from the FBI to the Department of Homeland Security and others, share responsibilities for protecting our critical networks. In part one of this podcast, you'll hear from two senior officials at the forefront of the ongoing duel with cyber criminals. Department of Homeland Security Undersecretary and Chief Intelligence Officer David Glawe, and DHS Assistant Director for Cybersecurity and Infrastructure Bryan Ware are speaking with John Riggi, a career FBI veteran who now serves as Senior Advisor for Cybersecurity and Risk for the American Hospital Association. And now to John.
Thank you, Tom. Very pleased and privileged to have as our guests today two very senior presidential appointees from the Department of Homeland Security. First, we have my very good friend and former FBI colleague, DHS Undersecretary and Chief Intelligence Officer, David Glawe. Also great to have DHS Assistant Secretary for the Cybersecurity and Infrastructure Agency, CISA, Bryan Ware. First, just a bit about our two guests' very impressive backgrounds. The Honorable David Glawe, and I can personally attest he is honorable, became the Undersecretary for Intelligence and Analysis in 2017. He is charged with providing the Secretary, DHS senior leadership, DHS components, private sector partners with the Homeland Security, intelligence, and information they need to keep the country safe, secure, and resilient. The Office of Intelligence and Analysis, INA, is a member of and the department's liaison to the U.S. intelligence community. Undersecretary Glawe also serves as the Chief Intelligence Officer for the department and as a counterterrorism coordinator. Undersecretary Glawe has a long career in law enforcement. Began as a police officer in Houston, Texas, then moved to Aurora, Colorado, prior to transitioning to federal law enforcement, serving both with the U.S. Postal Inspection Service and the FBI. Undersecretary Glawe also served in the Office of the Director of National Intelligence and the National Security Council. His numerous awards include the National Intelligence Superior Service Medal and the Department of Justice's Meritorious Public Service Award. Bryan Ware currently serves as the Assistant Director for the Cybersecurity Division within CISA. He was appointed to the position in January 2020. He previously served as the Assistant Secretary for Cyber Infrastructure and Resilience and Policy for the Department of Homeland Security. Prior to joining DHS, Mr. Ware was the co-founder and CEO of Digital Sandbox Incorporated, which was later acquired by Haystacks Technology, an analytics and software company, where Mr. Ware later became CEO. So thank you both for joining us today to discuss cybersecurity threats in our current environment. Let me start by asking you both why this conversation is so important and what's changed with the cyber threat landscape during today's crisis. You know, I can't help but think of the similarities between this crisis and 9/11, when the war on terrorism was brought to everyone's doorstep, except now it's not law enforcement, intelligence, and military on the front line. It's our civilian healthcare heroes on the front line, fighting an invisible yet prolific enemy in every community in the country. Dave, Undersecretary Glawe, maybe I can start with you first.
John, I just want to say thank you for having us here today and hosting us. And it's a real privilege to be able to speak to the association and your membership. And John, just as a good friend, it's great to hear from you, and I'm glad you and your family are safe during this crisis, and I hope you stay healthy as well as your colleagues. This is very personal for me with healthcare professionals. My sister is a physician, a family practice physician, and my brother-in-law is a nurse. She's been in this line of work for 25 years, and she's currently running the VA clinic in Eastern Iowa and doing the primary testing for COVID-19 in that clinic. We are facing a challenge that we've never seen in our lifetime from a pandemic, a viral pandemic, a healthcare crisis that is changing the landscape of threats. Every threat we're incorporating now within the national security apparatus, from terrorism to threats to critical infrastructure, the healthcare, the medical industry, the counterintelligence foreign influence threats we're getting from Russia, China, and Iran, the effects of COVID-19 on our supply chain, on our economic infrastructure, the bedrock of our economy, how transnational organized crimes are morphing to utilize this vulnerability we have with COVID-19, and of course our threats to the cybersecurity, the infrastructure of the United States, the backbone of the Internet of Things, the fraudulent actors, the foreign actors, and now looking at this to capitalize on this vulnerability. Our adversaries know how important the healthcare sector is, and it could be or may be a point of vulnerability. And Bryan will talk about it extensively today, how we're incorporating prevention methods, response methods, and partnering with federal law enforcement and the U.S. intelligence community to try to harden the industry to make it a hard target so you're not vulnerable. And this partnership is critical as we're moving down this new threat vector. And John, as you mentioned, this is very similar to the battle rhythm we learned post 9/11 in that terrorism environment as we both lived through at the FBI. But it's a changing environment now. We have partners we're partnering with that are traditionally not part of the U.S. intelligence community or law enforcement. How do we incorporate those new partners, the healthcare industry from the doctor side of the house, within the intelligence apparatus of really anticipating where the threats are going? Be proactive to get out in front of the threats so we're not reacting after an event occurs. It's a changing dynamic. It's developing, enhancing new partnerships like with certain parts of the medical profession, as well as enhancing the ones like with your association, John, in that partnership as well.
Thank you, Dave. Very informative and enlightening. Bryan, can I turn to you for your thoughts?
Yeah, John, first of all, thank you so much for having us on the podcast, and thank you to your listeners who are working in these really challenging times and working under tough circumstances on the front lines of this pandemic. For me, of course, in the cybersecurity business, cybersecurity is an important topic at all times, but it's really taken on some significant importance for all individuals and companies right now due to our increased reliance on technology and the way that we have to use it in our daily lives. I mean, broadly across the United States, kids are at home, distance learning, parents and workers are in many cases teleworking, and so this use of technology is enabling us to continue our lives and to try to continue the economy and continue our learning and so forth, but it also presents significant cybersecurity risks, and as Dave mentioned, our adversaries are always seeking to take advantage of those risks, either for criminal gains or for the goals of our nation state rivals. I think in your community, though, in particular, beyond just teleworking, as your listeners know, there's the increased use of electronic medical records due to more patients requiring care, our reliance on medical devices that are connected to the internet, and augmented use of telemedicine so that doctors who are not in emergency rooms can continue to see patients who require regular doctor's appointments. And so because of all of this, it's imperative that we all act with a heightened sense of security and care in all aspects of our lives. As Undersecretary Glawe put it, the threats that we're facing are real, but the U.S. government is working diligently to ensure that all members of the healthcare sector are prepared to handle this threat, and that we are doing everything that we can to support you.
Thanks, Bryan. Appreciate that. And again, thank you for your kind comments for our frontline heroes as well. They really do appreciate knowing that they have the support of the government. So let's talk a little bit more in specifics right now. So our nation's hospitals often hear and receive cyber threat announcements from a multitude of government agencies, including DHS, FBI, U.S. Secret Service, even more recently, the NSA. So it's great to receive all that threat information from the government. We have certainly come a long way. The government's come a long way in sharing. But sometimes, quite frankly, it also creates confusion as to which agency, simply put, does what and who to call at what time. Could you help us understand the role of DHS in terms of mitigating cyber threats in the U.S. and the healthcare sector in particular? Dave, why don't I start with you first?
Sure, John. And when it comes to the intelligence enterprise of aligning the threat information that's going to any industry, including the healthcare industry, I'm in charge of that for the department. So all of intelligence from all the component organizations and the offices to align it to make sure it goes through the correct standards, the production requirements, the legal requirements of that, to disseminate strategic and tactical level intelligence to all industry partners, not just the healthcare industry, but all the private sector partners. But from the operational side, and Assistant Secretary Ware will talk about it, how CISA partners with the FBI and other law enforcement organizations to provide that tactical level information that goes out. I would say, John, too, in the 9/11 environment, there was a maturity process, how the counterterrorism resources aligned and worked together in a cohesive enterprise approach. The Director of National Intelligence was stood up, the Joint Terrorism Task Force was stood up to align those resources so it's a cohesive, efficient enterprise, i.e. I'm the counterterrorism coordinator for the department and align within that structure. We're still at a maturity within the cyberspace of federal law enforcement and the U.S. intelligence community and how they work together. But I can say, I would never say you only should call one organization for your points of contact. If you have a good relationship with the FBI, if you have a good relationship with the Department of Homeland Security, reach out to those points of contact. But your primary contacts are CISA or the FBI. Those points of contact within the regions, within the municipalities, and at the federal level as well. And I'll turn over to Bryan to talk more about that infrastructure and the partnerships with the FBI, with the Secret Service, et cetera.
Thanks, Undersecretary Glawe. So CISA, as we say it, CISA, the Cybersecurity and Infrastructure Security Agency, we've got a really unique mission to bring together our agency partners in the federal government, so in the intelligence community and the law enforcement community and beyond, to make sure that we're bringing all of our best knowledge together and to try to help critical infrastructure like the medical infrastructure, to help that infrastructure understand the risks that they face. So I have colleagues that are responsible for emergency communications, making certain that our communication systems, which are so heavily tasked and that we're so reliant on right now, to make sure that they're functioning properly. And I have colleagues that are responsible for physical infrastructure, so the actual hospitals themselves or pharmaceutical companies or those telecommunications, the kind of the hardware, the physical locations of those. And then my responsibility is the cybersecurity and the cyber ecosystem broadly, ensuring that everything that we work across government and industry to ensure that our cyber systems that we rely on are secure and that they're resilient. We do this across federal agencies, state, local, tribal organizations, but also importantly, the private industry and critical infrastructure. So we offer a number of services to help mitigate cyber threats to those stakeholders. Our National Cyber Awareness System is where we share tips, activity alerts, analysis reports, and bulletins. Almost everything that we do, your listeners can find at CISA.gov, CISA.gov. And actually right now, there are banners on the website directly addressing two things that I think your listeners will find important. So one of them is just general COVID-19 guidance on everything from how to secure your teleworking environments to how to understand, the risks that may be new in this current environment. There's also another part of that website on critical infrastructure workers, and this is an area that's been leveraged, broadly across the United States to try to ensure that workers that are in these critical parts of our supply chain, our medical supply chain, or other critical parts of our economy are able to be identified and they can get to work. But on CISA.gov, we've got reports that are specifically designed for businesses and for government leaders. We call these CISA Essentials. We offer a series of products for Chief Information Security Officers and Chief Information Officers that we call CISA Insights. And CISA Insights provides guidance for implementing cybersecurity protections in a way that is the most similar to the way the federal government does it. So things like email security or domain name security and so forth. We offer vulnerability management services like our cyber hygiene program. This has been a real focus of ours during this period of time. We are significantly expanding the numbers of hospitals and health sector entities, commercial entities that we are performing cyber hygiene scanning. So this is scanning any devices that are connected to the internet where we can identify potential vulnerabilities and inform those agencies those vulnerabilities. That is a free service that CISA provides. You can see more about that on CISA.gov. We have a 24/7 CISA incident reporting system. That's a good resource for organizations who fall victim to a cybersecurity incident and need technical assistance to recover. So right on the website, you can reach out, and we do respond to those incidents. And if necessary, we bring our interagency partners. So, think about our role as the cyber defense coordinator. We are trying to secure our nation, the .gov, the government networks, as well as state and local tribal networks and commercial and critical infrastructure networks from malicious cyber actors, whether they be nation states or criminal elements. And that often puts us in a role in which we're going to coordinate with the intelligence community. We'll do that through our work with Dave's shop, as well as with our law enforcement partners if there's a criminal nexus in particular.
Thanks for that, Bryan. So just touching on a couple of points, Dave, Undersecretary Glawe, you mentioned how you're working across government and with private sector. As clearly as we learned after 9/11, the whole of government, whole of nation approach is really needed to fight terrorism. And great to see that approach is being taken now in the fight against COVID. Bryan, great comment about cyber hygiene as it applies in the healthcare profession. We often use the term cyber hygiene in terms of being as important as medical hygiene in protecting patients from risk. So great to see that analogy being made there. Let's talk a little bit about DHS itself. So DHS is a very large department, many component agencies, hundreds of thousands of professionals. Could you help us understand the roles of and perhaps the interaction between U.S. CERT, CISA, the Office of Intelligence Analysis, and the Secret Service when it comes to cyber threats? Dave, why don't we start with you?
Sure, John, and thank you. Yeah, we're a very large department of well over 20 component operational organizations and very large headquarters components. We're the third largest department in the U.S. government of over 250,000 personnel. In addition to the organizations you mentioned, we also have U.S. Coast Guard as part of that, Transportation Security Administration is part of that, really big organizations that are responsible for protecting the country. Specifically regarding my office in intelligence and the infrastructure that goes behind that. So I'm in charge of ensuring all of those offices and component organizations have the standards to share information with each other and external partners, that strategic intelligence or tactical level information to keep you safe, specifically for your industry, but all of the critical infrastructure industry on our state and local law enforcement and our private sector partners. And with that, I bring the Title 50 or the national security authorities. So to partner with the National Security Agency, to partner with the Central Intelligence Agency, to partner with the FBI's National Security Branch and their function over there, bringing that together in a cohesive enterprise to collect the information that's important for your industry and others. What are your biggest priority threats? How can I facilitate collection with those U.S. intelligence community organizations, specifically the NSA and CIA, to get those collection requirements out there under their authorities to collect the information and then get it to a classification level, secret or unclassified, so we can pass it to you so you know as real time as I can get of what's coming at you so you can put the good prevention mechanisms in place, but also to facilitate that conversation back with us of what are your collection requirements, what are your vulnerabilities you're seeing in your industry, and how can we help mitigate those threats with operational responses. And I'll turn that over to Bryan right there with what kind of operational response and partnership we have within DHS to provide services to you to identify and help mitigate those threats.
Go ahead, Bryan.
Let me start with a quick bit of background. So the Cybersecurity and Infrastructure Security Agency Act of 2018, this is our legislation that created CISA, formally signed into law on November 16, 2018. And that empowered the agency to restructure and streamline the legacy components of our organization based on the roles and functions. You mentioned U.S. CERT. U.S. CERT is part of CISA. That is our cyber and emergency response team. So it's a legacy agency, but in the CISA Act kind of rolled into just part of CISA. We provide key services to include routine cross-sector information sharing with federal, state, local, private sector entities, providing technical assistance and incident response capabilities, sharing mitigation information on cyber threats and vulnerabilities, and then disseminating threat and warning information. So we're often the lead or the primary federal agency when there's been a cyber incident, certainly in the executive branch. Oftentimes, the lead in terms of providing federal resources to a victim company or a victim state and local agency. And so when we do engage, we're trying to bring all of the resources of the U.S. government, as Dave mentioned, the intelligence community through INA, oftentimes working with the Secret Service. I've got quite a few Coast Guard cyber officers that are part of our teams, and we bring them with us as we are analyzing an incident or responding to an incident. So CISA is in some ways just a convener of the capabilities that the federal government can bring to bear in responding to, but most importantly in trying to prevent cyber incidents from taking place.
This concludes part one of a two-part series on how the Department of Homeland Security is coordinating the complex federal effort to thwart cyber criminals, especially those who are bent on attacking the computer networks of hospitals and health systems during this critical time. Stay tuned for the second part of this podcast, featuring the insights of DHS Undersecretary and Chief Intelligence Officer David Glawe and DHS Assistant Director for Cybersecurity and Infrastructure Security, Bryan Ware. This is Advancing Health, brought to you by the American Hospital Association.